eligibility requirements together with their qualified dependents. So who are the qualified dependents? So our legal spouse, it has to be legal. Our children below 21, children above 21 but with total disability, parents 60 years old and above who are not Philhealth members, and foster kids. So you can, a foster kid can be your dependent as long as you have a DSW certification that you are the foster parent of that kid. So when can benefits be availed? Next slide, please. Alright, so for confinements, for inpatient confinements, we need at least 24 hours of inpatient confinement. For outpatient surgical procedures and other surgical procedures. So for outpatient surgical procedures, examples of which are especially those who are undergoing dialysis. So those who undergo dialysis, those who undergo cataract procedures, such procedures are covered even if you are not admitted. Next slide. Where can we avail of our Philhealth packages? So definitely, since we are an insurance organization, the facility has to be Philhealth accredited. So it does not matter if it's in a hospital, a lying-in, outstanding dialysis centers, or ambulatory surgical clinics, as long as they are Philhealth accredited, you can avail of Philhealth benefits from that place. Next slide, please. Next. So an example of freestanding dialysis center, you have Asia Renal Care, NCDDI. For ambulatory surgical clinics, an example is ACES. Next slide, please. Next. Alright, so how do we avail of our benefits? So, next slide, please. Sorry. Okay, so first we need a 3/6 contribution requirement. So this is required if we are individually paying or we have our businesses and then we opt to pay individually. So what is 3/6 contribution? So you have to have 3 months payment within the immediate 6 months, including the month of confinement. So how do we count this? So example, we are now in November. So you have to have a contribution of 3 months within November. So we start November, October, September, August, July, and June. So if you have contributions at least 3 months from June to November, then automatically you can avail. But this is not a problem for those in the employed sector, because as long as the head of the company or whoever is in charge to sign the forms will sign the form for you, automatically you can avail for Philhealth benefits. Then what do you need to bring to the hospital for you to avail? So we used to require the member to bring their MDR or their Philhealth IDs. However, we have noticed that most of the members, when they go to the hospital, they don't bring this with them, so it's not in their wallets. So not to worry, because starting, I think about last year, we have a new system which we call the PBEF, wherein if you don't have the documentary requirements, you can just go to the Philhealth in charge of the facility, and then they will print out a form for you. So that machine will automatically tell you if you are eligible to avail of our benefits or not. So it gives you an instant answer. Okay? So next slide, please. Okay, so what benefits are available to our members? We have a lot, but then I was requested to talk only about Z benefits, so I'll just give you a bird's eye view. So what is Z benefit? So case type Z are the illnesses that the corporation has considered as limb-threatening or life-threatening. It requires prolonged hospitalization and extremely expensive therapies. Not all, you might say nga, tanan sakit kuan man kanang requires prolonged hospitalization or mahal o tambal. However, we don't cover for all. We have selected disease conditions that we considered or we enrolled under case type Z. So what are these disease entities? So by the way, so when you think of case type Z, it's equivalent to catastrophic for us, not in general, but it's a Philhealth category as catastrophic. Okay, so initially when case type Z was rolled out middle of 2012, we only had 4 diseases under it. So it's acute lymphoblastic leukemia with a coverage package of 210,000, breast cancer and prostate cancer at 100,000, and kidney transplant at 600,000. Since this is a package, so it includes everything from start of admission until discharge. Okay? PF is already included also in the package. So with, say for example, with our kidney transplant of 600,000, our doctor's PF is already included, which is 15% of the package rate. Next slide. As we expanded our coverage for Z, we included surgeries for CABG, or elective surgery for coronary artery bypass, tetralogy of Fallot, which I believe your organization is sponsoring under the Gift of Life project. We also have surgery for ventricular septal defect, and then we also cover for cervical cancer. So these are the disease conditions that are enrolled under case type Z. Next slide. But not all that I've mentioned is available in Region 7 because not all hospitals also are accredited to provide this service. So since this is something new, we only have one facility in Region 7 that gives out the Z benefit services, and this is Vicente Soto Memorial Medical Center. And then the diseases that are being serviced by Vicente Soto are the following. We have early stages of breast cancer, kidney transplant, coronary artery bypass graft, cervical cancer, selected orthopedic implant, prostate cancer, tetralogy of Fallot, and ventricular septal defect. So for now, only these 8 are available at Vicente Soto. We don't have the Z benefit package for acute lymphocytic leukemia in children. So this is it for Z benefit package. And then as a reminder lang for everyone, basic rule for Philhealth availment, we would require 24 hours hospitalization and should be done in a Philhealth accredited provider. So I think that would be all for Z benefit, and I hope this will help you with your Gift of Life project. Thank you.
Are there any questions for our guest speaker? Yes, Mitch?
Do you have any plan to expand that, let's say lung cancer or other rare disease cancers?
Actually, we are in the process of rolling out additional packages for Z. So what I know, for now, patay lung cancer. But I think we already have for colorectal cancer.